Now, there are growing concerns about a mumps outbreak at the moment. Cases in England increasing threefold so far this year. So do we need to be worried? Dr Ranj is here. Mumps, MMR, we know there was, a lot of controversy and there were people talked about, particularly one doctor talked about this connection between MMR and children having autism.
Being vaccinated
and,
or not.
And it was a big scare at the time and a lot of parents decided not to vaccinate their children. Is this linked in any way to
it's possibly one of the It's possibly one of the factors. So in the 1990s, when this MMR fraud was perpetrated by Dr Wakefield, who got struck off because of it, a lot of people didn't get vaccinated or didn't complete their vaccination schedules. And now that those people are older, possibly going to university, they are more likely to get things like mumps. And we have certainly seen a rise in cases. I think we've seen over 700 cases in the first quarter of 2019. We had just over 1,000 in the whole of 2018. And we're getting outbreaks around the country and indeed around the world.
Particularly at universities.
Yes.
And I presume because it's very contagious.
It's very, very catchy. It's a viral illness. A lot of people have forgotten what mumps was because of the success of vaccines. We don't remember how bad tetanus was, polio was, meningitis C used to be rife until vaccination came in.
Not that I'm aware of. Did mumps make you go...
Yeah, you went...
Yes, so it gives you this classical hamster-like face.
Hamster-like face, I think I've got that.
Yeah, so you get symptoms of fever, headache, loss of appetite, nausea, lethargy, parotid swelling, which gives you this...
There's a picture of me there.
This painful swelling of the face. But the complications, for most people, it's a benign self-limiting illness. The complications can be significant. You can get swelling and inflammation of the testicles, which can lead to shrinkage and a potential drop in sperm count.
Well, I was going to say, because often it's talked about, and particularly if men get it, in adulthood, that it can cause infertility. Is that true?
We think that it can drop your sperm count, but we don't think it's a major factor in infertility. Similar thing can happen with swelling of the ovaries as well. You can get pancreatitis, you can get swelling of the brain and the layers around the brain and spinal cord, and meningitis.
Are these all quite rare?
These are rare complications, but they are possible. A small proportion get temporary deafness, a tiny proportion get permanent deafness. And we do know, pre the 80s, when the MMR vaccine was actually introduced into our routine schedule, it used to cause around 5 deaths every year. So it's not an illness that we should just ignore.
How do you treat it?
So the best way, because it's spread like flu is often spread through particles that you cough or sneeze, one of the best ways to spread it is hand hygiene, coughing into a tissue and throwing it away, washing your hands if you're poorly, staying away, staying away from people that might have it. And obviously being very careful. If you've got symptoms, get in touch with your GP straight away to get advice. But vaccination is one of the best tools we currently have to prevent this illness, and it is preventable.
So are there not enough parents getting their children vaccinated? Do you think that there's a hangover from the 90s?
There really is. And we do know since then there have been lots and lots of international studies involving millions of children that prove that there is no link between autism and the MMR vaccine. In fact, I'll give you a little fact here. Japan stopped using the MMR vaccine after that scare came out. Their cases of autism still went up. So, that's just one piece of information.
But you can still catch mumps even if you have been vaccinated.
You can. So we think... So no vaccine is 100% perfect for lots of very complex reasons. There are some people who can't be vaccinated. There are some people who don't respond fully. If you have one dose of mumps vaccine, let's say, as part of the MMR, it's likely to be around...
Measles, rubella.
Mumps, measles, rubella. It's likely to be around 80% effective. If you have 2 doses, it's likely to be around 90% effective. Now, that's OK. If enough people get vaccinated, then that level of protection is enough to protect everybody, including those who can't be vaccinated and are at serious risk.
What age should you be getting your children vaccinated?
So MMR is currently offered at around 1 year of age, and then again at around 3.5 years, 3 years, 4 months. We do then sometimes also revaccinate at-risk populations, so people who aren't protected or when there's an outbreak. A lot of people have been asking, when's the earliest you can get your MMR done because they're worried about babies and small children. Well, actually, in certain conditions, when there is an outbreak, we may recommend having an MMR earlier than 1 year, but that is usually few and far between. If you've been vaccinated and you've been pregnant and you're breastfeeding, then you are likely to pass on some of your immunity to your baby for a couple of months at least. That's a good thing to do. But it may not be enough to protect them fully.
You're talking there about when is the earliest you can be vaccinated. When's the latest you can be vaccinated?
So there, a lot of us, including myself, might be unsure of what our vaccination record is, whether we've had measles, mumps or rubella before, whether we've been fully vaccinated with both doses. There is no harm if you don't know or your records are unclear in getting another dose. In fact...
You can't kind of overdose on the MMR.
You can't overdose. There is no evidence for that whatsoever. In fact, there is an argument that because the effectiveness of the mumps vaccine particularly wanes over time as you get older, there is an argument that we should possibly introduce a third dose later on in life. But there's lots of research going on to that at the moment as to whether that is a good idea and beneficial for most of the population. But if you're not sure, you can have another dose at any time. Even if you're pregnant or likely to be pregnant, have a chat with your midwife about it, because it may be that they vaccinate you after your pregnancy has gone through. But that's something that needs to be discussed specifically with your midwifery team.
But you're very much for vaccination?
Absolutely. We know through so much more research that has happened since the 1990s that this vaccine is effective and safe for the vast majority of people. And we need to remember that there are a lot of people online still spreading vaccine fake news. And for some reason, they enjoy doing it and they enjoy perpetrating this misinformation, and it's not safe.
Go and talk to your GP.
Go and talk to a healthcare professional.
OK, Doc, thanks very much.
Thank you, Ranj.
Appreciate that.